Lithium carbonate is indicated for the treatment of acute manic and mixed episodes associated with bipolar I disorder. It's used to terminate acute phases and prevent episodes from recurring.
So lithium carbonate comes in different forms. It comes in tablets, capsules, liquids, and extended release. So the extended release form is a type of the medication that is taken by mouth, and it's absorbed slowly by your body over time, and it helps reduce how often you take the medication and also lowers the amount of side effects. The dosage for patients who are 7 years and older and weigh 66 pounds, the dosage will start at 300 milligrams 3 times a day. It will then change to 300 milligrams every 3 days. To treat acute manic episodes, the patient will receive 600 milligrams 2 to 3 times a day. The usual dose for an acute episode and mixed episode is 600 milligrams 2 to 3 times daily, with a usual maintenance dose of 300 to 600 milligrams 2 to 3 times daily. The exact dose and frequency of the medication is determined by the primary care provider, and it should be taken cautiously for patients who are younger than 7 years and the elderly.
About lithium carbonate. The very first thing that a patient should be told is to take the medication as prescribed. Not taking the medication will show no results, while taking too much of the medication can cause severe side effects. Taking the medication as prescribed is very important. We should also let the patient know that signs of improvement can take up to 3 weeks, so be patient. One of the side effects of the med is dizziness, so patients should be told to avoid driving or any activity that requires alertness. The patient needs to be taught about their diet. The patient needs to maintain an adequate salt intake. Low levels of salt can cause lithium toxicity. Patients should notify the provider if they are vomiting or have diarrhea, because they can cause low sodium. Patients need to avoid tea, coffee, and cola because it will cause the patient to excrete too much urine. Patients could also see some weight gain, so a low-calorie diet could be beneficial. You might be asking, what does lithium toxicity even look like? The signs and symptoms of lithium toxicity include vomiting, diarrhea, slurred speech, lightheadedness, decreased coordination, muscle weakness, like irregular tremors or twitching. Patients should closely monitor for changes in heart rate, fainting, and difficulty breathing. If the patient notices any signs of toxicity, they need to stop taking the med and notify their doctor. Patients will need to provide a history of the medications that they take, over the counter and prescribed. This is taken to see if there are any medication interactions. Many interactions increase serotonin in the body, including lithium carbonate. If medications are combined with lithium carbonate, then it can cause serotonin syndrome, which means that there is too much serotonin for your body. Serotonin syndrome can cause tremors, fever, muscle rigidity, fast heart rate, and increased blood pressure. Patients should notify their doctor if they are pregnant. Taking lithium during pregnancy can cause fetal harm. Patients should avoid breastfeeding newborns. Patients should monitor their breastfed babies for signs of lithium toxicity, which are overactivity of the muscles, hypothermia, and a bluish change in color. Patients will need to get their lab work done to monitor for renal and thyroid function, white blood cells for infection risk, serum electrolytes for sodium levels, and blood sugar levels. The frequency of the lab work is determined by the provider. Lastly, if the patient has any questions or concerns, please contact your healthcare provider.
Acetaminophen, also known as Tylenol, can be used to alleviate some of these symptoms. Potential life-threatening side effects include seizures, serotonin syndrome, and pseudomotor cerebri. If you experience confusion, restlessness, agitation, sweating, fever, tremors, over-responsive reflexes, or temporary memory loss, you should seek help at your nearest hospital, as you may be having an adverse reaction to lithium.